tuned in to the Andrew Lawton Show.
Our good friends at secondstreet.org have a new documentary out saying we need to have a wholesale national conversation about healthcare reform. The documentary is called Health Reform Now. Let's take a look at the trailer here if we can.
Poured out very recently, citing that Canada's the second best healthcare system in the world.
We begin tonight with the agonizing pain patients are facing.
I've seen wait times lead directly to people dying, including children.
She has lost 2 daughters due to long wait times in the healthcare system.
When you have elective surgery, they elect to stall you off as long as they possibly can. What kind of a healthcare system is that?
I already waited 7 years. Can you imagine 2 more just to see the specialist?
So the last thing the chief financial officer of a hospital wants is patience.
Is it normal to see so much patient suffering in a developed country like Canada?
The documentary just out, available at healthreformnow.ca, produced by secondstreet.org, whose president, Colin Craig, joins us now. Good to talk to you, Colin. Thanks for coming back on. Congratulations on the launch.
Well, thank you, Andrew. It's always enjoy chatting with you.
Well, reform is one of these tricky words because it can mean anything and nothing depending on who says it. And, there are many ways you could reform the system, some for the better, some for the worse. What is it that this film is trying to tell people?
Well, anyone who follows healthcare debate in this country knows that Canadians love the idea of having a universal healthcare system. The problem, of course, is that it's not working. We spend a lot of money. We're one of the highest spenders in the world. We have a lot of good people working in the system too. The problem is the structure of the system is broken. It's not conducive to getting good results for patients on a consistent basis. And, certainly some people have good experiences with the healthcare system. That's wonderful. But the problem is too many patients are falling between the cracks. And so really what we do in the documentary is we look at other better performing universal healthcare systems, particularly in Europe, and we examine 5 policies that are in place in those types of countries so that you ultimately would see better policies here in Canada. So basically we can copy what people are doing much better than us, and then we can bring those good results to Canada.
One of the big challenges we see in this country is that people cling to this idea of the healthcare system being something that it really isn't. And I'll say perfectly candidly that the utopian version of the healthcare system is fantastic. It's something that's free. Anyone can access it. No matter where you are in the country, you can go and get it. But if you scratch even just a tiny little bit below the surface, that's not the experience that Canadians have with the system. And look, I have had many run-ins with the healthcare system. Whenever I have needed emergency treatment, I have zero complaints whatsoever. I've been able to get it. The issue is not with emergencies. The issue is with these things that are very pressing for people, but might not rise to the level of, your organs are falling out all over the floor. And that category, the stats are just horrendous.
Mm-hmm. Yeah, and Jerry alluded to this, as you would have seen in the trailer just now, that when you have elective cases in particular, they elect to make you wait because they can. And it's not right. There's so many people that are suffering because of this. People that are literally stuck in their apartments dealing with chronic pain. It's brutal. Grandmas and grandpas that can't pick up their grandkids or babysit them or be part of their lives because they can't keep up with them. And if the grandkids crawl on them, then it causes too much pain. Just horrible stories like that. People walking around with cloudy vision while they wait for cataract surgery. We've actually heard, some bad cases in emergency rooms too, where, in one case in Winnipeg, they reported that the situation was so bad earlier this year that they had to double bunk 2 patients on a single stretcher in the hospital. Like it's gotten to a point where it's really, really unacceptable in this country. And I think some people have become a little bit numb to just assuming, well, this is how it is, or we have the US system. And what we talk about in the documentary is that, no, that doesn't have to be the choice. let's look to Europe, let's look to Australia and other developed nations that have better performing universal healthcare systems. Because if we copy what they do, we can ease patient suffering so that people aren't measuring their wait times in years and maybe get back to weeks, which is where it should be in a developed country such as ours.
In the Shaoli case in Quebec, which was one of the most frustrating examples of our legal system at work, because this was the case where the Supreme Court basically ruled that access to a waiting list is not access to healthcare, which is a crucial ruling. But they basically found the exact opposite in another case that has basically found that you only have a right to alternatives in Quebec and nowhere else in the country. So we can talk about the legal aspect there, but that fundamental point there that came out of that case, that access to a waiting list is not access to healthcare, that seems to be the missing recognition by the government across the country, is it not?
Yeah, it is. You're not providing health care if someone's on a waiting list for a year or two and they're dealing with chronic pain and they're getting addicted to painkillers and all the horrible side effects that I just talked about. Mm-hmm. It's not ethical, but for some reason we've just allowed that to continue. And, I think political parties of all stripes have largely been guilty for 30 years of throwing money at the problem and hoping it would go away because they haven't been prepared to have that conversation with Canadians about reform. It is a delicate issue, but public opinion is in favor of reform. People, I think, have watched this story play out. They're saying it's not working. This approach where we throw money at the system, it's not working. We spend a lot. We're not getting the results we need. So the public is actually on side with reform. We haven't seen enough political parties and politicians sort of run with it now and say, okay, here's what we're going to do. We're going to try out some new things like that have been effective in other countries in Europe and Australia and other countries. And that's, I think, the stage where we need to be. We're seeing a bit of that. There's some positive signs in this country where we're seeing some reform measures happen, but it's not quick enough. And until we start to see a greater push in that direction, we're going to continue to see people suffering in the healthcare system.
So when you say, Colin, that the public is on board with reform, that in a lot of ways flies in the face of what the conventional understanding is, which is that this is a political third rail. And I think we see bits of this anecdotally. Anytime a politician has even so much as hinted at the idea of private delivery, you get this just absolute, holy hellfire from Liberal and New Democrat parties and some activist groups talking about switching to some, pay-to-play healthcare system. And so are you saying that those attacks are not representative of where Canadians are? Because I would have actually thought it would go the other way. The Canadians really are uncomfortable with the idea of a change, even if they don't love how things are.
Yeah, so we've done a lot of polling on this. It's all on our website if anyone wants to see it, secondstreet.org. The public overwhelmingly supports what we're seeing in different parts of the country where the government will contract with a nonprofit clinic or a private clinic and pay them to provide care to treatment to patients in the public system. The public supports that. John or Joe patient doesn't care who is flicking the switch of the x-ray machine. They don't care if it's a government employee or a private sector employee or if they're unionized or non-unionized or if they have black hair or brown hair or whatever. They don't care about any of that. They just care that they get the quality treatment. They also don't want to pay for it. Directly with the bill when they walk out. Of course, everything is paid for with the taxes, and so that's what we're seeing in provinces like Ontario, where the government is now partnering more with private clinics and nonprofit clinics to provide those services to the public, and the public overwhelmingly is supportive of doing that if it can be done in a cost-effective way and help more patients. The public is on side with that. You mentioned the Chow-Lee decision. The public is overwhelmingly on side. It's in the 60s, 70% range. When you ask the question, should we keep the public healthcare system, but allow people to pay for private options if they don't want to use the public system? The public overwhelmingly supports that. There's other policies that we talk about in the documentary that the public is on board with. What you see in Europe, where a patient in one EU country can go to another EU country, pay for treatment, and then get reimbursed by their home country. This is how you can avoid long wait times at home. If you happen to be facing one in Europe, you can go to all these other countries in the EU. Suddenly you've got hundreds, if not thousands of options for care instead of just relying on what is available locally. The public loves this idea of bringing that policy to Canada. So you could maybe go to another province and pay for treatment. south of the border, or to maybe you go over to Europe, whatever. So the public is definitely there and ready for health reform, but we're not seeing the political class move quickly enough to recognize that with promises in terms of decisions.
Yeah, I mean, I'll be the first to say the United States healthcare system has a lot of flaws, and most people that have the discussion you and I are having right now are not saying we should replace our system with the U.S. when there are so many better examples around the world. But when I cross the border, at Port Huron, an hour from where I live in Michigan, and you see the billboards on the interstate advertising, MRIs and X-rays to Canadians, you know that something is not working in Canada. Otherwise, there would not be this booming marketing industry in border communities to provide healthcare services to Canadians.
Yeah, exactly. Yeah, hundreds of thousands of Canadians every year get into their cars, drive to the U.S., they get into airplanes, and they go to the U.S. or other countries for healthcare. I mean, we've talked to patients that have gone over to I think it was Lithuania, Germany, Mexico, the United States, China, Thailand, you name it. Canadians are going all over the world to get the treatment.
All right. Well, people can check out this issue in far more detail at healthreformnow.ca. The documentary produced by our friends at secondstreet.org is Health Reform Now. Colin Craig, always good to talk to you. Thanks for coming on today.
Thanks for the chat today, Andrew. Appreciate it.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.